Hi everyone, I'm coming to you from a different location today, but I thought I would keep rolling with this series and talk to you a little bit about what to expect once you've had that consult with your radiation oncologist and you've decided to go ahead with having radiation therapy. So at that appointment, your radiation oncologist will tell you what their recommendation is for your treatment. So that will be the number of treatments that they expect that you would have. Now, this can sometimes change, so just be aware. Once we've done the planning scan, sometimes they may make small changes based on what they see on that scan, okay? That's normal. But once that's been determined, then they will request an appointment for you to have a CT simulation. Now, it's so important to know that your treatment plan that the radiation oncologist suggests is based on multiple factors, and they're very personal. So your treatment is not going to be the same as Joe down the street or Mary that your friend knows, okay? So many things go into deciding how many treatments you're going to have. And those things can include your diagnosis, so what type of cancer you have, what area of the body we're treating. It can also be determined based on your personal health and well-being. So if you have other diseases or conditions that may make this a little bit harder for your body to take, we take all of that into consideration. It's also, they take into consideration whether or not you are a candidate or had surgery, chemotherapy, immunotherapy, any of the other therapies. They work complementary with each other for many cancers, but not all. So just keep that in mind. A lot of factors go into determining how often we're going to see you, okay? Now, once that's been determined, the doctor will put in a request to get you a CT simulation appointment. Once you have that appointment, when you come in for that appointment, we are going to be doing a CT scan in order to get information that we can do our treatment planning on, okay? Now, it is so important that you are comfortable. Now, our tables, we call them a table or a couch or a bed. I would say a table is definitely the best description. It's not comfortable. Now, the reason it's not comfortable is because, well, we don't want you to stand for a nap, but also we just need you to be in a fairly rigid and a position that can't really vary with like a comfy, cushy surface, right? So, but we still do require you to be comfortable enough that you could stay still for 10 to 30 minutes. Okay, so when you go to that appointment, we are going to get you into a treatment position that's required for the area of the body we're treating. Some areas of the body require immobilization devices just to help you stay nice and still for us. That will all be determined and discussed with you at your appointment. And in further videos, I will talk about some of the different devices that we use in order to achieve this. But it's so important for you to speak up at that appointment. I'm telling you, don't be shy, okay? We want to make sure that you are as comfortable as you can possibly be on a hard table with some aids so that you're able to stay still for us at treatment, because we have to replicate that same position every day for treatment. And we don't want you to be comfortable every time you come and uncomfortable every time you come and see us, okay? So at that appointment, they are going to do a scan of the area we're going to be treating. And then they're going to localize. So it kind of works like a GPS system. So we may put 3 to 4, I mentioned in the last video, little marks. Now, some centers do tattoos, some may use other means in order to localize, but we need them to be relatively permanent because it takes a few weeks usually to plan your treatment, and when you come back for your first treatment, we need those marks to still be there, because everything that we do as radiation therapists on a day-to-day basis is based on those initial marks. So essentially those are the starting point. And then we kind of get GPS coordinates from the doctor and the planning team to move from those to get to the area of treatment. Okay, they just pick a general area that's stable, that we can then make shifts from to get to our destination. So once they've done that scan, they'll give you some information about how long it may take to hear about your first appointment, depending on the busyness of the center. From there, your scan heads to our treatment planning department, and the radiation oncologist will go ahead and mark the area of concern for us, and they will clearly lay out a plan for what our treatment planners need to achieve. So our biggest goal is to get the most dose to the tumor and the least dose to the rest of your normal tissues. And so that may take, a little bit of time. And then after that plan is made, there are plenty of checks and balances that we need to do before we bring you in for your first treatment. We have the oncologist will go over it. A second treatment planner will verify that everything makes sense, everything looks good. And then we have a physics department that also goes through many, many checks to make sure that everything makes sense and is perfect for you, okay? Once that's done and the treatment is approved, then we're gonna move to your first treatment. So you should get a call with a treatment time for your first appointment. Sometimes some of you may have to do some sort of prep before you come for treatment. Again, this will vary from center to center, but for example, depending on the area of the body we're treating, some people may be on chemotherapy and have to get chemotherapy before coming to their treatment, or they may take an oral chemotherapy pill before treatment, or they may be told that they can't eat or drink 2 hours before their treatment, and that's just to optimize the body for the treatment. Some patients may have to have a full bladder for treatment, so you will be given all of this information before you come. So it's important to follow these instructions because we are really doing those to get the body primed and ready so that we are achieving the, again, most dose to the tumor or the residual tumor or whatever we're treating, and the least amount to the rest of your normal tissues. So that's kind of it. And then you'll come in for your first treatment appointment. And I talked a little bit about that in my first video. Now, I'm gonna close this one out here, but if you have any questions, please let me know. I think my next video will kind of cover how does radiation work? How does it target the tumor cells and avoid killing your normal cells? That's an interesting topic. I can also talk about types of radiation because there are lots of different types of radiation and they can be used for different things. But yeah, I would love to hear your feedback on these videos and whether or not you have any important questions that you'd like me to answer. Thanks so much for joining me today.